presenting. Part of the information was from the lectures for the Doctor of Pharmacy program. The definition for the heart failure is, as I said, is chronic and progressive condition in which the heart muscle is unable to pump enough blood to meet the body's blood and oxygen needs. These are different types of heart disease or conditions that affect the heart. The one that is heart failure on the left side, dilated ventricle, that is due to diastolic heart failure, in which the left ventricle muscle is weakened and dilated and cannot pump enough blood. And the other one is the one under cardiomyopathy, which is the lowest picture in the middle, bottom part. In that case, due to hypertension or other comorbidities, the left ventricle thickens, the muscle thickens, and cannot hold enough blood in that chamber to pump out. So you get the issue with heart failure again. That one is called diastolic heart failure. I'm sorry, that was called systolic heart failure, the one with thickened muscle. Also, you have other conditions like pericarditis, coronary artery disease, any of the valve, the issues, they also cause heart problem, aneurysm, and also cardiac arrhythmias. Here's systolic and diastolic picture of the heart failure. On the left is systolic, in which the left ventricle is thickened, and so the left is diastolic, and the most common cause is hypertension causing this problem. On the right side is systolic heart failure, in which the cardiac muscle is weakened and cannot pump enough blood to the outside. Heart failure prevalence, it says 1 in 5 people will develop heart failure, a condition where the heart cannot pump enough blood around the body. And heart failure is the most common cause of hospitalization in people aged 65 and over. Half of the people hospitalized for heart failure will die within 5 years. So this picture just shows 4 people going in, 2 coming out after 5 years alive. This is congestive heart failure pathophysiology, the different problems with the condition. The main one is myocardial contractility, or cardiac compliance is decreased, and volume overload, decreased preload, increased afterload. Factors contributing to heart failure, high blood pressure is number 1. Then you have lung disease, heart problem, like different parts of the heart, like valve, heart rhythm, heart muscle defects, other disorders, or coronary heart disease. Other medical conditions that contribute to heart failure include anemia, kidney disease, diabetes, obesity, and thyroid disorders. Lifestyle, including alcohol and drug misuse and failing to take preventive medication, and if you consume too much salt or too much fluid in your diet, also contribute to heart failure. This is again a picture of a diastolic heart on the right side versus normal heart. These are definitions for preload. Volume of blood received by the heart is preload. Basically, preload is a stretch, the amount of volume being returned to the heart. Afterload is the pressure or resistance that heart has to overcome to eject blood. So afterload is basically like a squeeze, amount of resistance that heart has to overcome in order to eject blood. There are some cartoons depicting the two conditions. The heart has compensatory mechanism that our body does in order to compensate for heart failure. One is to increase heart rate and cardiac contractility, cardiac dilation, and these cause myocardial hypertrophy. And in systemic level, increased blood volume, redistribution of blood flow, increased erythrocytes, increased ability of tissue to utilize oxygen. There's also brain atrial natriuretic peptide and also renin-angiotensin system to compensate for failing heart. The main markers for cardiac compensatory mechanism are AMP or BNP, brain natriuretic peptide, and atrial natriuretic peptide. There are some complications of heart failure, including cor pulmonale. It's the enlargement of the right ventricle, usually caused by COPD or high blood pressure in the lungs. 2 is ventricular dilation and hypertrophy. Pleural effusion, also lung edema in the lung or fluid in the lung. Atrial fibrillation, hepatomegaly, renal insufficiency, and acute decompensated heart failure. These are the complications. When you have acute decompensated heart failure, it's like waterboarding, and it's basically you feel like you're being drowned in your own fluid. This is again definition of acute decompensated heart failure. Is the function of deterioration of a system that has been previously working with the help of compensatory mechanism. ADHF causes cough that produces frothy sputum that may be tinged with blood. This refers to feeling of suffocating or drowning. Leads to wheezing or gasping for breath, also anxiety, restlessness, or a sense of apprehension. Orthopnea, cyanosis, dyspnea, or tachypnea. Accessory muscle use, cool and clammy skin, crackles, wheeze, tachycardia. I'm going to discuss this section, then we close the video and discuss it later in another video in continuation. Factors that worsen heart failure: sodium and fluid consumption, as we mentioned before, acute myocardial ischemia or heart issue, high blood pressure, calcium channel blockers. So these are contraindicated in heart failure, including verapamil, nifedipine, or diltiazem. The steroids or NSAIDs, the group of diabetic medicine, thiazolidinediones, pioglitazone is one of them. Concurrent infection, mitral prolapse, and hospitalization. These are factors that worsen heart failure. Thank you for your attention to the video. Please like the video if you like me to provide more videos like this.